All right, so para empezar, cuéntanos un poco sobre la sarampión. What can you tell us about measles?
Okay, measles is an incredibly contagious viral infection that can affect both children as well as adults. And it's usually heralded by uh, high fevers that go on for many, many days, along with a rash, uh, along with red eyes, runny nose, sore throat, and a whole bunch of other features. But measles is also associated with a lot of important complications. So it's certainly something that we would like to prevent.
Perfect. También este fin de semana se registró un caso de sarampión en el área de Dayton. ¿Qué nos puede contar sobre eso? There was a case of measles that was reported in the Dayton area over the weekend. What can you tell us about that case? How often do cases like these happen in the state of Ohio?
Yeah, so we are definitely starting to see measles cases and small outbreaks of measles around the country. In the last month, certainly there's been more cases, mainly on the East Coast, but it's just a matter of time before we start seeing cases all across the country. Last year in December in the Columbus, Ohio area, there were about 100 cases of measles tied to an outbreak. And I suspect we will be seeing more of those types of cases.
¿Qué se puede vincular a este aumento en estos casos de sarampión? What can you attribute to the rise in these measles cases lately?
Yeah, measles is incredibly contagious. And so whenever there are pockets of individuals who are not fully immunized against measles, we're going to continue to see cases pop up. And most of the cases of measles that we see, if not all, are in children who have not been vaccinated or have been incompletely vaccinated against measles. The really
Perfect.
good news, yeah, the really good news is that we have a very, very safe and very effective vaccine against measles, so that if everybody receives 2 doses of measles vaccine, they are about 97% protected against measles. The problem is when you have a community where the vaccination rate is not high, there are going to be crops of measles. And once measles is introduced into a small community, it is so contagious that it will spread very, very rapidly among those who are not fully immunized.
Entonces parece que el reto real no es necesariamente contenerlo, es prevenirlo antes de que ocurra. Looks like the most important thing is not trying to prevent its spread, but more so stop it before it could even happen.
Yeah, that's exactly right. Preventing the spread of measles is very difficult because, again, once it gets introduced, it is so contagious. It is one of the most highly contagious viruses that we have. And anybody who is susceptible because they have not been fully vaccinated, if they're anywhere around measles, there's a good chance that they will get measles. So definitely the best way to protect everyone is to be fully vaccinated.
Perfecto. También el Departamento de Salud de Ohio compartió información el día de hoy sobre cómo se notó un poco de sarampión en el área del aeropuerto de Cincinnati. ¿Por qué eso es algo que hay que tomar en cuenta y qué qué sugerencias nos pueden dar a nosotros, a las personas que tal vez visiten el aeropuerto de Cleveland? I know that also the Ohio Department of Health today shared some information on how measles was tracked near the Cincinnati airport. You know, why is it so important to keep something like that in mind? And what steps can people, for example, in Cleveland Hopkins take to make sure they're safe?
Yeah, so many of the cases of measles that have been tied to these outbreaks that we have been seeing have been occurring in individuals who are not fully vaccinated and not protected against measles, traveling to parts of the world where measles is much more common. So it's not unusual for them to be traveling, contract measles in other countries, and then bring it back here and spread it amongst those who are not fully vaccinated. And, I'm not sure about the specifics of this particular case, but clearly there were many exposures at the airport. It's not clear to me that the case of measles came from overseas, or whether that child traveled, or whether that child picked up measles from somebody who has recently traveled.
Gotcha. Should people that, let's say, over the next few days are considering using Cleveland Hopkins to travel, are there any steps that you recommend them taking to stay safe as they go through the airport?
Yeah, airports certainly are places where there are a lot of individuals obviously traveling, and so people coming from other parts of the world where many of these contagious infections may be more common. Certainly, that's something to pay attention to. But really, the best thing to do is to take care of yourself and make sure that you are fully protected against everything that you can be. And measles is really a great example of that.
Gotcha. So I know that people may think whenever there's a disease, I know a lot of people may be a little they have may have grown some habits from COVID-19 to wear a mask when you're at the airport and stuff like that. That may not be something necessarily that would make an impact in this case.
Yeah, every measles is so highly contagious that surgical masks are probably not going to be enough to prevent measles. You really need good N95 masks to prevent measles. But the practicality of the whole population in airports wearing masks, it's probably better to just be sure that you can certainly take care of yourself. Certainly, if you're at risk, wearing masks certainly is always a good idea, especially in places where there are a lot of people. But with measles specifically, surgical masks are probably not going to help a whole lot. And really, vaccination is really by far the most effective way to protect against measles.
Gotcha. Just to wrap up, is there anything else about measles that we should keep in mind here in Northeast Ohio? These were some cases that were registered in the southwestern part of the state in the Dayton, Cincinnati area. But what are some things we should keep in mind here in this corner of the state?
Yeah, the only thing that we really need to keep in mind is that with the higher rate of children not being vaccinated against measles, certainly again, where there are populations of unvaccinated individuals, anytime measles gets introduced into those areas, and that could certainly be in Northeast Ohio, there will be a risk that we're going to have an outbreak. Hopefully that's not going to happen, but the reality of the situation is that this can happen anywhere where there are individuals who are not completely vaccinated.
Entonces, el noreste de Ohio no está garantizado esa seguridad. Northeast Ohio isn't guaranteed any safety on this.
Absolutely not. Again, anywhere, the only way that we can guarantee safety is to make sure the immunization rates are as high as can be against measles.
Gotcha. Anything else I didn't touch on you want me to keep in mind?
Just that measles vaccine is incredibly safe and well tolerated, and that everybody needs to have 2 doses of measles vaccine to be completely protected.